Hi, everyone, and welcome to our fifth and final webinar today about designing measurable outcomes and demonstrate program impact. My name is Tracy Morgan. I'm the Director of Population Health at the National Rural Health Resource Center, and I'm the Program Director for the CAST program. It's really nice to have you here this afternoon. A little bit about our organization. I think by now, if you've attended these, you are aware, but just in case, the National Rural Health Resource Center is a nonprofit organization that's dedicated to sustaining and improving healthcare in rural America. We do our work in the 5 different core areas you can see there bulleted on the screen, and we're the nation's leading knowledge and technical assistance center in rural healthcare. This project is a collaborative effort with the Flex monitoring team. Both of us are funded through the Federal Office of Rural Health Policy within PERSA to serve the Flex programs, and are honored to be part of those cooperative agreements. Like I mentioned, this is our 5th webinar, and the purpose of this webinar series has been really helping to deepen the State Flex program's understanding about program evaluation. We timed it purposefully with sort of being ahead of when the notice of funding opportunities coming out for the Flex programs, and we realized that's out now on the streets, and you all are working vigorously on that. So hopefully the timing has been good to kind of get the wheels in motion to think about program evaluation and how you can design your next 5-year iteration of the Flex program to achieve great evaluation outcomes. Each of these webinars has been structured in a 60-minute format where we have a brief presentation by our experts with the Flex monitoring team, and then we engage in some sort of activities together. We'll be doing something very similar to what we did in the 4th webinar today. We'll talk about that more coming up here in a minute. The previous recordings are all linked there on the screen on your slides that you'll have access to. They're on our website too. If you just type in evaluation and search, you'll find a collection of resources that are specific to the Flex program and these webinars that we can go to. So I'd like to welcome John Gale and Megan Lahr to kind of kick us off with the concept here today.
Great. Thanks, Tracy. This will be a wrap-up discussion. We'll try to be brief because the real work will be when we break out into sections and pick up on the work that we started the last time. So a lot of what we'll do is look over and review and reinforce the concepts of evaluation, help you think more about a funding cycle approach. I think this, to me, is one of the important evolutions, if you will, of the evaluation planning under the Flex program, to think about how activities roll up across, not only across each individual year, but across the multiple years of the funding cycle. How to use it as a foundation for program planning and impact. And we'll take a few minutes to discuss the new work plan templates and recording requirements. So thank you. Can I have the next slide, please?
Sure. So just like in the previous webinars, we've been talking about how these webinars relate to the core competencies for State Flex program excellence. So there's a whole host of different things that the content relates to, but today we're really honing in on managing information and evaluation and paying attention to those proficiencies that are highlighted in your screen in yellow about utilizing process measures, and we'll be talking today about outcome measures as well to really assess progress, but also plan for the future. And then looking at those measurable outcomes to really demonstrate the impact. What is the point of what we're trying to do is there's a lot of things we're trying to achieve in the Flex program, but if we can't describe it well, we can't measure it, there's no story really to tell. So how can we get to that place? So we're going to take a couple minutes here and do our pre-polling. It helps us know if we're effective here at us in the Flex monitoring team and preparing this content for you. So there's a couple questions, 3 of them on your screen about your knowledge coming in about program planning and evaluation. Questions about knowledge about using a logic model. And then your knowledge about designing measurable outcomes. Take a minute or two, we'll look at those results before we move on. And Caroline, feel free to close that on broadcast. The results if you feel like you're complete. So coming into today, it looks like most of you are either confident or moderately familiar with your knowledge of using program planning and evaluation as a foundation for demonstrating impact.
Hey, Tracy, I'm not trying to interrupt you, but you sound a little bit far away from the microphone.
Why? Okay. I will address that once John starts speaking. So I'll try to
Okay, perfect.
When we look at your knowledge about using a logic model for planning in your state funding cycle, most of you are either confident or moderately familiar with that. So that's great. And then looking at your knowledge about how to design measurable outcomes that could be implemented in your state, most of you are moderately familiar with that. So that's wonderful. I think we have a couple more polling questions here to find more information out from you. So there's two more questions here about how many webinars have you participated in? They can be either live or recorded, but what's been your presence in looking at these webinar series? And then lastly, have you looked at the work plan template and the template examples that are located on the text website? So it looks like kind of split a little bit of the fix mostly about who's participated in 1, 2, 3, or 5 of these webinars. So again, those recordings are available. This content has been building on itself. So if you feel like you're missing something today, if we're moving through things, go back and look at the previous recordings and just know that they're there for your reference. And it looks like the majority of you have referenced already the flex work plan template and the template examples. And we'll talk a little bit more about those. So thanks so much for taking time to answer those, and I'll turn it back over to you, John.
Thank you, Tracy. The importance of evaluation, we've been over this before, but I always like to step back. This is really, evaluation is critical to being able to track your activities and see where an impact is being made. It's a core competency of the Flex program. But if you think about it, we're now in 25 years of the Critical Access Hospital Program and Flex funding. And I think it's really important to be able to look back over time and as we move forward to say, what is the program accomplishing? And evaluation is the critical piece to this. It's also critical to program management and improvement. And as all of you probably have guessed and surmised by now, it's going to be an essential and an important component of the upcoming notice of funding opportunity for the Flex program. So these webinars are designed to build one on the next. And also, if you have new staff coming on board, this is always an important resource so you can bring people up to speed. Next slide, please. This is a management tool, pure and simple. And I think the more that people think of evaluation as a management tool rather than just something that happens after the fact to say, well, did we do what we had planned to do? Flex programs are complicated. You're operating in an incredibly complicated environment with many things impacting your hospitals. Some of which is in your control and the hospital's control, some of which isn't. But you start with a planning phase, and that's the critical side, looking at your theories of change. And then throughout the course of the project, you track the outputs, data and outcomes, and keep your work plan updated. It's not unusual to see change in the course of what you proposed in your work plans, in your applications. Something comes up that you hadn't planned on. Some of it may be hospital participation. Perfect example is COVID. And look what that did to all of our work. But if you do this and keep evaluation as a management tool throughout your program, you can bring these back to ensure you're achieving desired results and update your program as you go along. I think it's important to understand that outcome measurement is really driven by your activities and the things you're trying to accomplish, and so that you can update them. And you may need to change. If something changes in your environment, that's important. Don't get stuck on the same outcome measures without change. So next slide. These programs aren't linear. We all know this. If you look at where as we think about inputs and your program investments and your outputs and activities, what you do, who you're reaching, and then your outcomes, short, medium, and long term. And you may be cycling back and forth through some of them. Participation may shift. You may have hospitals that have become part of a bigger system that pulls them out of your work. But there's change are important. And as you're working through the medium term outcomes, 2-3 years, looking back at your activities. Are they working the way you expect? Are you achieving the goals? And so this is really just a very important, and in many ways you can think of this as a plan, PDSA, plan, do, strategy cycles. So again, I think this is, the more you understand that there are feedback loops and dimensions, the more you can manage your program. Next slide. So let's go over the key terms. This is a continuous process, so the emphasis on continuous, that begins with identifying needs and challenges and gaps and continues through implementing a project. You determine impact by measuring where you are, where you've been, and where you want to go. And outcomes are measurable changes from an activity or series of activities. And as we've noticed, short-term, 1 year to 2, intermediate 2 to 3, and long-term 3 to 5 years or more. Next slide. Outputs and outcomes, always a favorite conversation. Makes us very exciting at parties. Outputs, you monitor program activities, how many personnel from your hospitals are attending a financial training, how many of these participants report that they improve their knowledge. And then the outcomes are the actual changes that take place. They monitor the benefits to the participants in your hospitals. So you could look at a percent improvement in hospital margins, percent reduction in accounts receivable, but these are all very much think of them as a bit of a roadmap. I know that's an analogy I've used before, but I think it makes sense. You know where you want to go. And as you go along the way, you'll find detours, you'll find changes, you'll maybe find a bridge out, but you can always come back to that if you have that map and the end goal in mind. Next slide. Start with the end product in mind. What do you want to accomplish? And then work from backwards from that point to determine where the steps are. So planning starts with the end in mind. You want a final destination, and an evaluation tells you what do you want. It's really a process of what do you want to know and how will you know it. And as you move through the different stages of this logic model, with your situation and your priorities, what you're inputting in terms of investment in time and staff, money, research-based materials, partnerships with consulting firms, your resources and inputs, then activities are the things that you do in your participation, and finally, a logical step-by-step process to get to the end goal. Next slide. And this is something I think I'm very happy to see us focusing on, which is really this funding cycle approach. And over the years, I think there's been less of a tendency to think this way, but you start with year one. This is your one of the funding cycle. You're focusing on assessment, identifying cohort participants, capacity building, and activity implementation. And your strategy is to figure out your baseline data and your process measurement. Year one is really about implementation. And if you don't implement correctly, then it's going to call into question the rest of what you do. And then years 2 through 5 are the sequential steps in building project activities from year to year and building on that foundation. Always focus on short and intermediate term measures in each project year. And as you go along, review your progress against plans and baseline data and adjust accordingly. Next slide. It's connecting the dots. And it's as simple as it's an analogy that always works for me. Your project theory has changed as your starting point. It's a clear definition of the problem to be solved and who's going to be engaged. Without that, I think many of us have started projects and we've had wonderful hopes for engagement, and we find that our hospitals, our EMS agencies perhaps isn't what they need, or they have a different view of what's going on. So you really need to focus on that. What is the evidence base to address identified problems? Look at activities that build on one and the next, and then you look at your scheduling, scope, and cost of activities, all starting at the beginning. Then you move through the process, collect data in the short term, intermediate and long terms, and then use them to update and change if needed. If you're fortunate, it may not be, but it's a process of constantly reassessing and resetting activities from year to year. Next slide. And this is a graphic that I've always liked because you think about how you move through the life cycles. You start with the assessment. What's the nature of the problem? As you move into completing your competitive funding applications, you'll have a basic needs assessment. But as you go into each year, it's important to always sort of give a quick check to make sure you're on track. Who's going to be engaged? Who are the cohorts? What is your strategic planning? This is about planning and creating that design, creating the roadmaps and stepping stones that move you forward. Design strategies. What does your intervention look like? How is it going to achieve your outcomes? And through the implementation process, you continue to monitor that. And at the end, you should be able to say at the end of the day, what did you accomplish and how did the activities and the work that we did contribute to those accomplishments? Next slide. So activities with outcomes, not all activities are the same. You may not have outcomes in the first year if you're building capacity and you're engaging participants and cohort members and bringing them into the process. Some of your outcomes may be different for each facility depending on where they are. Say if you're looking at revenue cycle management, they may all have a slightly different set of issues. Keep it simple. Use best practices and examples when available to you. I think that is always something that I go back to. Why reinvent the wheel when you can learn from the experience of others, and then tailor the outcomes to phases in the life cycle. Early phases, capacity building, revenue cycle is one I always go back to. That's an essential part of the capacity of a hospital to do its work and to be paid for its work. And then later you focus on the activities directly impacting your performance and improving outcome metrics. Next slide. Thinking along these lines, the example we're providing is if you're looking at improving patient and family engagement in a cohort base. In the short term, it's capacity. How many participating cohort members are you projecting? What percentage of them are participating in program activities? If you're doing participant surveys, are they improving their understanding of how to impact patient and family engagement metrics, how to implement and why? In the intermediate term, and this is agency performance or hospital performance, there are things that we know make sense and contribute to this. How many of them are completing admissions checklists at the beds in each CAH? Who's completing bedside shift reports? What percentage of hospitals are having liaison engagements with patients and families in each hospital in the long term? And this is where you start seeing the system performance, improvements in pre-discharge patient satisfaction scores. Are patients leaving the hospital with the information that they need to manage their medications or to avoid unnecessary readmissions? Are your HCAP scores going up, and what is the percent improvement? And at the end of the day, if you're improving your patient satisfaction, you're providing services that make sense and are valued by patients, you should see an increase in patient utilization, which at the end of the day is a really important goal. Next slide. Tracy, I think you want to talk about the work plan template.
How about now? Hopefully you can hear me now. Oh.
Very, very well.
Not my first time on Zoom today. I'm sorry, everyone. So for the work plan template, we just wanted to provide a reminder about what exists out there to support you. So there is a template for use by your Flex program to lay out your plans for fiscal year 2024 next year and beyond into the 5-year cycle into 2028. There's also a template that's full of examples in each of the program areas. So they might not be exactly the type of work you want to do, but they should give you some good ideas about what to put into the different columns. There's instructions within the template. And then there's an instructional video that was put together by the Flex Monitoring Team, Task, and the Federal Office of Rural Health Policy that walks you through exactly how to use that template. So if you enter into the template and you're a little bit confused, use the resources that are available to you. We put a lot of time into effort into that, but we might not answer all of your questions in there. So if you have additional questions or if something's still not making sense, please do reach out to us at Task. We'll try to answer your question. If we're not the right entity to, we'll funnel you along to FRHP or the Flex Monitoring Team or Akita to whatever is the best group to answer your question. So please take advantage of these resources as you're working into your NOFO and how to respond to things. And yeah, there's a video link there too. John, you want to talk about other tools?
I just take myself off mute. So there are a number of tools. The new work plan templates, I think you'll find very, very helpful. Some of the past work that we've done on the Flex Monitoring Team is we have a toolkit on logic models, includes theories of change. We'll be updating an outcome measurement toolkit this spring. And then we have a number of briefs on outcome measurements on financial and operational performance improvement, EMS, and population health. We've also done work on cohort improvement, and I hope you find them helpful. They include examples. They try to really focus on a revenue cycle or funding cycle perspective. And finally, from our colleagues at Task and the National Rural Health Resource Center, we have the Flex Performance Management and Evaluation Guide. I think these will give you a lot of what you need in terms of building your evaluation strategy into your Flex programs.
Question? We do have a few minutes. Yeah, we have a few minutes for questions. Does anyone have any questions? I encourage you to come off on mute and feel free to ask them or type them in the chat. We can wait here a minute or two before we get into our exercise.
Hi, this is Stephanie from Idaho. I don't necessarily think it's a question of like outputs versus outcomes. I think I can wrap my brain around that enough. I think where I get challenged is short-term versus long-term, especially when you're looking over a 5-year period. And so not only are you trying to figure out what activities to do and where folks are going to need it, like especially when you're looking at, well, it could be in finance as well, but I would say in quality, since we have kind of newer measures and everybody's sort of starting from scratch to a certain extent, how like knowing how to look at that over time in advance. I think one thing is year to year, but it's that kind of foreshadowing out. Is there a way to write an outcome that allows for enough flexibility, but yet it's specific enough to where you can get the information that you need? Are there any tricks of the trade with regard to that? Because that's kind of where I struggle the most.
I don't know. I think, oh, go ahead, John.
No, go ahead, Megan.
Yeah, I was just going to say, I think in thinking about, especially in quality, if you're looking at new measures and really not knowing where you're going to be with some of them, I think that's tricky. We're in the same boat, right? As we start to think about benchmarks, what can the MBQuip benchmarks be for some of these measures? We're not going to know for a little bit. And so it is really hard when you have new measures and you don't have that data. I think obviously when you're able to get a bench or a baseline for something, so your starting value, that will be helpful to see where you go. But I think I always encourage folks to think about this as kind of incremental change. And so it could be a percentage increase in how well they're doing, which if you look at something like that, that really helps you to try to think about it's going to be different for each of your hospitals, right? Someone might be performing a lot higher or a lot better than someone else. And so that gives you the flexibility to be able to do something incrementally. But also I think with those new measures, it may be, once they start reporting, really seeing where they can change. And I think it really does depend on the measures. There are different things you can be working on within them, but just that those incremental increases and what you can do in a year, and then thinking this may be something that we need to come back and ask this for them in 2 years, right? And so looking at those short term, what can be done in a year, maybe up to 2 years, but those intermediate outcomes are really just kind of where you may be at more for some of these. And I think there's the understanding that for some of these new MBQuit measures specifically, it's going to be a little bit hard to have some of those right away. And so really being creative with what is available to you there. But John or Tracy.
Thank you for that, Meg.
Well, I was going to say one of the things that I would do is really think about how and what are the steps that would influence the change in the measures. So HCAHPS is a perfect example. There are a number of different elements of HCAHPS that you might want to focus on. And are you improving? What are the things that drive patient satisfaction? There's a lot of literature out there. So are you doing sort of the discharge planning? Do you have just conversations around what a patient's needs are? Does the family feel engaged? Do you have a process to discuss with patients the different aspects of their care and what they might need? And so I think a lot of it is taking a look at the high level measure and kind of breaking it down into different action steps, basically a set of stepping stones. And you build first on the foundation. How well are they using their electronic health records? Are they using them as a tool? Can you help there? Do they have the tools they need to begin to do bedside changes? And so all of that in terms of reporting it. And I think a lot of it is breaking it down into steps.
Yeah, I agree with all of that. I think keeping that end goal in mind, and then there's so many different ways to go about that goal. And I like that good check that you can use with the theory of change, the if-then statement. Like, if this happens, is it logical that I can expect that this happens? And that can really benefit you, Stephanie, as you move into the intermediate outcomes too. If I keep building on these activities and move from short-term outcomes within a year to intermediate term outcomes, is it logical that I can expect this type of progression? So hopefully that helps.
Yeah, it does. Thank you very much. I think I am a very literal person. And so to see percent of change or even the if then, so already trying to figure out sort of the activity, and you're working with maybe one hospital, but if you're doing a cohort, trying to figure out sort of all of the ways to measure it. So would you kind of pull them all into that percent of improvement or percent of change to that baseline? I guess it would depend on how you're reporting your baseline in the beginning anyway, if you're going to do it hospital by hospital or an average of them, right?
Yeah, and I think that's one thing within the work plan is to kind of figure out, it's fine if hospitals are looking at different measures, right? You may have a cohort and they may all be looking at different things. And so that's okay. And so then looking at, you may need to do some adjusting on, it may not all be the same percentage of change based on kind of John's point, how you break it down and what each of them is working on. And that's okay. But it's just making sure that there's something there that you're able to track and see. If they're doing this, then are we going to see kind of those next steps and how they're improving?
Perfect. Okay, thanks. That helps a lot, you guys. Thank you so much.
Well,
Mary, I see you have your hand up, and Megan, there's a question in the chat that maybe you can address right in the chat, but go ahead, Mary.
I think Megan just answered it, but I'll throw it out there to see if she has more additional. I'm seeing that we really can have very different impacts based on whether the hospitals are independent or part of a system. So how to start to slice goals that are realistic for people who don't have a lot of individual on the ground change has begun to bother me, but I think Megan just said the answer. You can break them down.
Yeah, so right. And so again, they're all going to be starting somewhere a little bit different. And so where they're starting or what types of support they may have in their projects, I think makes it a big difference. And so you can be tracking different outcomes across your hospitals, across your facilities. And also they're even if they are working on the same outcome measure, you may have different goals for each of them, right? You may not have the same expectations for them.
Do you think that that ought to be delineated in the work plan, like non-system hospitals, system? I mean, how would you splice that up in a nice gridded work plan?
So So I think the best way there would be to, so there's what you put in the work plan as far as what your overall project goal is. What are you looking at for your project? Later, when you get into baseline in that information isn't in your work plan that you submit right now, right? Because you don't know which facilities you're going to have. And so I think it's coming up with that starting goal, where do you want to make that impact and kind of what do you want to see in your project overall? But then later, I think as you're getting into, you're not going to know where your hospitals are starting. You may guess that, all the systems are going to be starting higher and those independent aren't, or, whatever, but you're not going to know until you see your facility data. So I think that's less of a what you put in your work plan now question. And I think now is kind of your best estimate of overall what you want to see happen, kind of that if we do these activities, this is what might happen in our project.
Okay, thank you.
Well, and I think also if you're working with a cohort, and I really think and can't stress how important the cohort work has been. You save trying to reinvent the wheel for every hospital. You can early on in the process, as you recruit them, you can bring them together and ask them what they can measure, what's important. So if it is on improving patient and family engagement, you can ask them what their weaknesses are and where their starting points, and use that to help you build in the specifics of your activities and what you're going to do. I think a lot of it is really engaging them. And I think the cohort can save you from being the nudge of all time in terms of collecting data if everyone is setting the standards of expectations regarding performance and reporting data. But use that early on to have that conversation with the hospitals. You can really fine tune what you're proposing to their needs.
Yeah, and just to address Jill's question quick was, will the CA inventory assessment be is it going to be the same every year? So you get to finalize what that's going to look like in future years, but we anticipate that much of the assessment would be the same, mostly because the largest component in the assessment is the collection of the CA quality infrastructure measure itself. And so that component will remain the same and will be in there. We anticipate that we will trade off on some of the sections, and so it won't be the same exact one every year. We may collect certain things every other year, but that's yet to be finalized as far as what we're collecting. But the biggest component, which is that CA quality infrastructure measure, that will remain the same, and that will be corrected each year because that will be that's part of MBQuip.
Thanks, Megan.